COVID-19, what is it? What does it mean for us in the South African context? Should we panic? Should we not? What are some of the key things that we need to take note of? I'm going to try to address all of these today in this short video, this short infomercial, if you will, because of the amount of global panic that has ensued and the amount of misinformation that is circulating online, which is insane. So as somebody with expertise in microbiology and biochemistry, and as a third-year pharmacy student, I thought I'd share some light on what is important for you to know, what can you do if you feel that you might have contracted the coronavirus, and in the South African context, what is being done to prepare our healthcare system for what could inevitably be an influx of patients. So late last year, on the 31st of December, the Chinese government reported to the World Health Organization the first cases of the novel coronavirus. The COVID-19 name which has been given essentially is the name of the disease, which is coronavirus disease 2019. COVID-19 is caused by the SARS-CoV-2 virus. That is the confirmed causative virus for the coronavirus disease 2019. This is also known as 2019 nCoV or 2019 novel coronavirus. Patients who have tested positively for the novel coronavirus have most commonly reported flu-like symptoms such as runny nose, sore throat, fever, cough, and in the most severe cases, difficulty breathing, severe respiratory inhibition, right? Most rarely, the disease can be fatal, and this is in older individuals most commonly, but the disease can also affect people with pre-existing conditions such as asthma, diabetes, or heart disease more severely than a young individual who has a better chance of recovery. This is the trend that we've seen globally and worldwide, and this is also why the World Health Organization is telling people that there is no need to panic right at this stage. The novel coronavirus, yes, we do not have any treatment for it. There is currently a vaccine in development which is expected to be ready in about 18 months from now, which does seem like a long time for something that is affecting us right now. But if you look at the fact that the coronavirus is not going anywhere, it's actually, this is one of the fastest turnaround times for a vaccine in development, which is very encouraging to hear from the World Health Organization. And they are sponsoring many studies that are going on right this moment to look into possible treatments, possible preventative methods for the novel coronavirus. In the South African context, today is the 14th of March 2020, and if you have been following what has been happening, the South African government on the 27th of February ordered by a directive of the president an evacuation of South African citizens who were living in Wuhan city in the Hubei province of China. Those 132, I think it is, 132 South Africans who indicated a desire to be removed from Wuhan city have landed in South Africa today. I need you to know the date because the information that I'm providing to you is correct and up to date as of today, the 14th of February. Those South African patients will be in a 21-day additional quarantine in the Limpopo province of South Africa. And the South African government will communicate what will happen further with those individuals after the 21 days of quarantine have expired. In South Africa, currently the number of positive cases that have been reported and have been identified stands at 24. This is of the 13th of March, which was yesterday, as the National Institute for Communicable Diseases, the NICD, confirmed 8 new imported COVID virus positive cases. These 8 new positive infections are unrelated to the 10 individuals who first arrived from Italy, where our patient 0 also traveled from. So these 8 new additional imported cases are completely new. Now, people of South Africa, please, this is important to understand. As more cases develop, which is inevitable by the transmission mode of this virus is going to spread. Let's get that straight. It is going to spread, and the more we incite panic about it, is just not going to help everybody. So, as I was saying, it's just not going to help anybody. So, as I was saying, the number of cases, as they increase, will mean that more people will be tested, which will mean that by default, the number of positive cases will go up because people are going to test positive for this virus. I cannot stress this enough. This will mean that the numbers are going to rise. It is an expected increase. It is not unexpected. This is why the Department of Health does not seem fazed by an increased number of cases. Many people are going around spreading sightless and foundationless claims that the government is too relaxed about this COVID-19 virus and it is now a global pandemic and people are assuming that we should shut down our airports. Yes, measures are being taken, but we are not at the stage that the Chinese government and the European governments are at the moment, where international sporting gatherings have been closed and many of the major mega churches in America have not cancelled, but have opted not to have physical gatherings tomorrow morning and are rather having online services. We are not there as a country yet in terms of the response to a global pandemic when it reaches your country. So 24 confirmed cases in the country, 10 from KwaZulu-Natal, 10 from Gauteng, 3 in the Western Cape, and 1 in Mpumalanga. There is currently no evidence, this is important, from the National Health Laboratory Services as well as from the NICD. There is currently no evidence that the virus is widely circulating in the South African community. However, and this is important to understand, like I highlighted earlier, from what we know about how the virus has spread internationally, it is going to move in the South African community. Please, people, we need to understand this. Transmission is unlikely to change in terms of the pattern of transmission and as well as the mode of transmission for the virus. But from past experience, the virus is going to spread. Our numbers are going to increase, and as those increase, more positive cases will come up because we will be testing for more people. This is not reason to panic. I don't know if I'm going to calm anybody's nerves about this virus right now, but we might not be the most well-placed health system in the world to deal with something like this, but currently there is no evidence that the virus is widely spread, and the containment measures that we have put in place, the contact tracing that is happening, is effective as of today. The virus is not contained. We expect that numbers will increase, but the containment measures that have been put in place are effectively working for the level of spread that we have in our country at the moment. So how is the South African government and the Department of Health identifying persons under investigation, persons with suspected coronavirus? So any person with an acute respiratory illness who has had onset of at least one of the following: a cough, a sore throat, shortness of breath, and a fever which is elevated above 38 degrees Celsius, irrespective of admission status. And one of the following epidemiological criteria must have been met as well. The person must have either been in close contact with a confirmed or probable case of SARS-CoV-2 in the 14 days from onset of symptoms, or they must have had a history of travel to one of the areas that is affected by SARS-CoV-2, or they must have worked in or attended a healthcare facility where patients who have been tested positive for SARS-CoV-2 are being treated, or any persons admitted with severe pneumonia of unknown etiology, so of unknown origin. Those are the criteria which you must meet in order to be considered a person under investigation by the Department of Health currently. Okay, so what I want to do now, after giving you information about the current status of COVID-19 in South Africa, I'm going to try to debunk some of the most common myths that have come up globally and as well as on South African social media and South African media, which is disappointing, but try to give you some clarity on these. Firstly, do vaccines against pneumonia protect you against the new coronavirus? And the answer is no, they do not. Vaccines against pneumonia, against Haemophilus influenza type B, do not provide protection against the new coronavirus. Why? This virus is so new and so different, it needs its own unique vaccine in order to work. Researchers, like I mentioned earlier, are currently developing a new vaccine, which a vaccine is currently in development, one that is tested, one that is proven to be slightly effective, is currently in development. The World Health Organization is working closely with the scientists and the researchers that are developing that vaccine, and the turnaround time has been incredibly quick. We are about to enter into the clinical phase of this, and so we are expecting results from that very soon. Although these vaccines for pneumonia do not work against the new coronavirus, vaccination against respiratory illnesses and infections is highly recommended to protect your health in the event that you do pick up the novel coronavirus. That is myth number one. Secondly, and I don't know where this comes from, but does putting sesame seed oil on your skin block the coronavirus from entering the body? And the answer is no. Sesame seed oil does not kill the new coronavirus. This has been tested, and this is information that has been posted from the World Health Organization. There are some chemicals which can kill the 2019 N coronavirus on surfaces. These include bleach or chlorine-based disinfectants, ether solvents, 75% ethanol, paracetic acid, and chloroform. However, and this is very important, these kill the N coronavirus on surfaces. They have little or no impact on the virus if you put them on your skin or under your nose. And please, ladies and gentlemen, young and old, it can be dangerous, extremely dangerous, to put some of these disinfectants on your skin or inside of your mouth or inside of your nose. Chemical burns are real, they are difficult to treat. So please do not put these chemicals on your skin. If you are using hand sanitizer, please make sure that the alcohol content is above 60%. Most commercial hand sanitizers will have an alcohol content of 62%. That should be effective enough to disinfect your skin. Okay, but please do understand that the chlorine and bleach-based disinfectants, ether solvents, 75% ethanol, paracetic acid, and chloroform, those are surface disinfectants that have been proven to kill the 2019 N coronavirus. Next, can gargling with mouthwash prevent you from contracting the coronavirus? The answer is no. Although there is evidence that using mouthwash can protect you from infection with the new coronavirus, some evidence, right? It's a bit shaky. Some brands of mouthwash can eliminate certain microbes, some others, and this mostly because of the nature of the microflora in your mouth will only reduce the number of bacteria in your mouth for a short amount of time. And so it does not mean it will protect you from contracting the 2019 coronavirus infection. Can your pets at home, your beloved dog, your beloved cat, spread the new 2019 coronavirus? I do know there was one case that I read recently, of a dog that had been suspected to have contracted the coronavirus. That dog had later tested negative, so if you did your follow-up research, you would have seen that. So at present, there is no evidence that your household companions, your pets, your dogs, your beloved family members, there is no evidence that they can contract or transmit the new coronavirus. However, this is general advice. It is always a good idea to wash your hands with soap and water after contact with your pets. This is to prevent infection from other bacteria such as E. coli, salmonella, and things that can easily pass between pets and humans, especially if you kiss your dog a lot and you have wet sloppy kisses with dog saliva. Anyway, is it safe to open and to receive your package from China? This your long-awaited online delivery, which has finally arrived, but you realize that it arrived from China. Yes, it is safe to handle packages from China. Why is this so? A lot of research has gone into understanding that the novel coronavirus only survives for a few hours on surfaces. Even so, please wash your hands regularly after handling anything right now. After handling anything, just wash your hands with warm, soapy water. There are many hand washing tutorials that are online currently on the National Institute of Communicable Diseases, the World Health Organization, the Department of Health. You can find this information anywhere. If you are handling anything right now, before you put your hands to your face, before you eat, before you touch anything else, before you greet, after you've greeted people, before you greet your newborn babies or whatever the case may be, please, 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 wash your hands. It is safe to handle your packages from China. Just wash your hands afterwards. The next myth is, can eating garlic help you from contracting the new 2019 coronavirus? Garlic is a good, healthy food. Yes, I am not denying that. I am supporting that fully because it has some antimicrobial properties. However, there is no hard evidence that it is protective against the novel 2019 coronavirus. Please understand this, people. Garlic is healthy, yes. Garlic has antimicrobial properties, yes. But proven to be effective against the 2019 coronavirus? No, not yet. Are there any specific medicines to prevent or treat the new coronavirus? The hard answer to this and the unfortunate answer to this at the moment is no, there are not. Please do not fall victim to online scams, online pharmacies that are selling proposed cures and treatments and medicines for the coronavirus. Please, ladies and gentlemen, do not fall scam to these. This information and the information that you should be reading is from very trusted sources such as the World Health Organization and in South Africa, the NICD. Please understand that there, to date, the 14th of March, there is no specific medicine recommendation to prevent or to treat the new coronavirus. This is important to understand. If your specific treatments are under investigation, however, these still need to be tested through clinical trials, and so we need to be a little bit patient on that front, because obviously we try to make sure, we do make sure that medicines that are about to come into the market are very safe to be used in humans and are effective against their indications before we give them to you. This is part of our professional obligation, and as a pharmaceutical sector, it is one of the vital roles that we play. Medicines, your vaccines, your treatments are safe and effective after being tested thoroughly. So we need to allow the thorough testing to take place. Are antibiotics effective against preventing the new coronavirus? I don't know. You tell me. Antibiotics? Virus? Many of you still walk away from the doctor's office with antibiotics for the flu. So I cannot understand right now why this is even a myth, right? Maybe we need, as health professionals, need to educate the general society and the general population more about this. Ladies and gentlemen, antibiotics do not work for viruses. End of story. Okay, so those are some of the myths that have been traveling around on social media and on the internet, and even from our media houses around the world and even in the country. And I hope that has shed some information on where we stand as a country currently. I hope you have some more information on how to deal with coronavirus from a mental perspective to reduce the level of panic that you're currently experiencing. Please, ladies and gentlemen, the latest health alert from the Department of Health states the following, and I'm going to read it verbatim so that I don't miss anything. South African travelers from China and other countries with coronavirus outbreak. Travelers returning from China and other countries with a novel coronavirus outbreak are advised to monitor their health for fever, cough, difficulty in breathing for up to 14 days. Travelers should stay at home during this 14-day period. Stay at home. A health official will contact you to give additional instructions. If you develop a fever, a cough, or have difficulty in breathing, please call your doctor. I'm going to put the number below of a hotline that has been developed for anyone who feels that they have met the criteria earlier that I spoke to about symptoms, as well as having come in close contact or traveled to an area or been in or near a healthcare facility that is treating patients who have been tested positive for COVID-19. Please do not go to your healthcare professional, your doctor or your pharmacist or the nearest clinic, because you run the risk of infecting those people who are on the front lines of treating this disease. You run the risk of infecting other people. You run the risk of infecting those who you accidentally or unintentionally come into contact with. So if you meet those criteria strictly, people, please do not inundate this hotline. If you meet those criteria, please contact the hotline and somebody will be sent to evaluate you where you are. This is important for containment. If we are to keep this virus from spreading, please understand that if you meet those criteria, you need to stay at home. Firstly, observe yourself for the 14-day quarantine period, and after that, if you're still experiencing some of these symptoms, please call the hotline immediately. Thank you very much. I hope you guys will share this video. Please comment on anything that I haven't mentioned or an error that I've made. I've tried to be very factual. The information has all come from the NICD and the World Health Organization as well, excuse me, as well as the National Department of Health. But if there is anything that I've left out or anything that you feel is unfactual, please comment below or inbox me on Instagram or on Twitter, and I will try to get back to you as shortly as possible. Ciao, ciao.